Hi, it's Jessica DeMassa with What's the Future of Health? We are talking to the who's who of health technology and healthcare innovation. And today we have the founder and CEO of a company that describes itself as a habit change provider. And this is a new category that they're launching. So we're going to have to check this out. But please meet Jeff Ruby, the founder and CEO of Newtopia. Jeff, it's a pleasure to have you here.
Jess, so great to be here. Thank you for having me.
All right, so I want to jump into this new category in a second, but before we do, I feel like you should introduce Newtopia to everybody who may not be familiar with the company. You guys are publicly traded on the Toronto Stock Exchange, 60 million Canadian market cap, 40 million American market cap. And you guys are interesting to me for a couple reasons. Two in particular. One, the fact that you guys are tackling, chronic disease, preventing, managing, reversing in some cases, with a behavior change model, and that you've got a lot of numbers backing up what you've been able to do, both on the outcome side and on the cost side. And the second thing that I really think is very compelling about Utopia is the fact that you guys, your model is at risk. So no outcomes, no payment. So wrapping those two things into your answer, just tell us about Newtopia, introduce everybody to what it is that you guys do.
Absolutely. Newtopia is a tech-enabled habit change provider focused on preventing disease and keeping people healthy. We've got this whole health approach where we're really focused on preventing, reversing, and slowing the progression of chronic disease while enriching mental health, resilience, and ultimately human performance. And what we're doing is really looking at the 80% of the population who've got elevated risk factors for chronic disease, and in getting to know them really well, socially, behaviorally, genetically, we leverage that information to design these unique experiences. They're all virtual, that blend the best of human with the best of digital, all proven to have a significant physical health risk impact, but also a significant mental and emotional health impact, so that we can improve their health, all while partnering with whoever is insuring those individuals. Today, our focus has been on innovator self-insured employers, but we also have application to private or public insurers where we've been able to not only keep their employees or members healthier, but also significantly drive down their costs. And here's the kicker, and most importantly, drive outcomes that grow. So over time, this habit change approach improves that physical mental health cost savings over time. So at 12 months, 24 months, 36 months, those outcomes are growing. And I'm not aware of anyone who's doing that today.
Okay, we need to dive into all of this, but I want to go back to the actual crux of the way the product is designed. And I want you to talk a little bit more about the three things that you mentioned there. It was there's a mental health component, there's a genetics component, which I think is really interesting. And then there's the nutrition, exercise, typical chronic condition, management type stuff that's bundled together. So say more about this and why you decided to take this approach to designing this type of product.
Yeah, so for us, we've been really pioneering in this precision health approach for over a decade now, and the objective is really to meet individuals where they are. The foundation of Newtopia is just this belief that the most effective thing that we can provide individuals and our insurer partners is our habit change outcomes, really outcomes that grow. And to deliver outcomes that grow, we've got to go to one size fits one in our orientation. And so we're not here to teach. We're not teaching a curriculum. We're not instructing people what to do. We're really meeting them where they are. And so we're learning about them socially, social determinants of health wise, from a behavioral perspective, personality type, motivation type, readiness to change. And then genetic engagement is the most novel, where we're leveraging genetics unlike everyone else. It's not about ancestry or risk identification. It's actually trying to help each individual what they may have inherited from mom and dad so they can stop blaming themselves, but also how to shape the actual.
Real quick, just stop right there. Like what? Like what would they have inherited? Like a propensity towards high cholesterol, or what are some? Give us some examples so that we can really understand.
Yeah, for sure. There are 4 genes that we're evaluating today that really align around metabolism, fat processing, ability through dopamine to handle stress signals and cravings, and most recently around BDNF, around stress and resilience. And so it's really able to first understand, hey, have I inherited these things? Can I stop blaming myself? Because so much of this is a blame game. And if someone feels that there's nothing they can do about it, that they just don't have the self-discipline, lack the confidence, then there's no, I mean, whether you try to teach them or change their habits, you've got a block. And we found that there's a real power in opening up individuals to the possibility of change by having them not blame themselves. And then secondly, move to the second point, which is how do we arm them with a greater sense of control over what to do about it? Effectively, how do we leverage the genetic information we collect to shape, within evidence and guidelines, the recommendations we provide across nutrition, exercise, mental and emotional health? And so what we're not doing is we're not providing, is it carrots or peas or jumping jacks or lunges? Quite frankly, I actually don't believe the science is there to go that specific, but as we shape macronutrients, or as we shape form and intensity of activity, or the kind of social supports that may be required around sleep and resilience, that is very much appropriate. And it's amazing the buy-up and the, oh, this is what I should be doing, and the buy into it from a motivation standpoint. It's incredibly powerful.
No, I think that's really compelling. And I don't think I've heard of like genomics being used in that way to kind of help empower people in terms of understanding, you know, the why behind some of the behaviors that they have, or the why behind some of the risk factors that they may have, you know, just based on who they are. I think that's really interesting. So I teased at the beginning that you guys have a lot of numbers that kind of back you guys up. You were born out of Aetna. I mean, right? Like, I mean, you were born with a clinical, a randomized control trial with Aetna to study the efficacy of this approach. So say a little bit about that, because I think like this is like a pedigree that not very many health tech companies have out there.
I mean, we definitely took a unique route to commercialization where we spent 3 years in a large-scale randomized control trial funded by Aetna Innovations. There are only really 3 companies that came through Aetna Innovations. There's Teladoc, Able2, and Utopia, all incredible health innovators. Really wonderful company, and went through this amazing rigor of the Aetna Innovations team, whereby on a huge sample size, 2,835 Aetna employees, we spent 3 years studying a participant group and a randomized control group to really determine the efficacy of our platform. And we were able to publish in peer-reviewed journal industry-leading outcomes with regard to physical risk reduction, clinical cost savings, and even demonstrate a proven in-year ROI. Really powerful when you're talking about prevention, when so much question is around, is there an ROI at all, and when does it show up? And the fact that it showed up in year was incredibly powerful. We were also able to demonstrate what I'm most proud of, these outcomes that grow. And so at 24 months, we were able to double our outcomes that we achieved at 24 months, which is so important because for an insurer like Aetna and their employees, it means that the outcomes are growing, their return is growing. For the individuals, it means that they're not just having a short-term 12-week or 16-week results that recedes. These are outcomes that build over time. And of course, Newtopia has built a performance-based model that you alluded to, which also we get to benefit in that gain share over time as well as a value-based partner.
Okay, so can you say a little bit more about that? Like, especially after that first year, so the second year, I mean, how long does somebody need to be engaged with the Newtopia platform to continue to see benefits from it so you guys can continue to get paid?
I mean, the objective was really not to establish an end date. We also, we're not looking for a lifelong commitment. I mean, ultimately, we measure our key outcomes at the end of 12 months. We think that's a really meaningful time frame. But then we leave the opportunity available for participants to continue their growth. We're also not big fans of a concept of maintenance. And so the idea is just, where do you want to go next? It's almost this sort of journey that people are on. You've gone from A to B, and now it's sort of B to C and continuing. And so years 2 and 3, we have Newtopians that have been on the platform for 5 years that began in the Aetna RCT, and now that we are working with CVS Health, continue. And so the idea here is not to pull the tablecloth away. It's really just to provide that support of the human, who are our inspirators, and the technology as much or as little as they need it over time, all with proven economics as to why the employer or insurer should be continuing to fund this as well.
All right, I want to talk a little bit about those economics because I came across the actuarial study that was just recently published. $1,700 per Medicare Advantage member you guys are able to save. Talk me through this a little bit, because that's a significant amount of money right there.
Yeah, so we had, we're incredibly proud of it, and much of our life has been spent following our 3-year randomized control trial in the commercial space, working with some real leading innovators, including Aetna, who's brought us to CVS Health. We're proud to be aligned with them, working with JP Morgan Chase, Accenture, Levi's as examples of the innovative employers. But we've actually seen a huge opportunity to apply what we've built in the habit change space to the Medicare Advantage. We've looked at all of our outcomes in the 65 plus. We've outpaced our RCT outcomes. And so we commissioned an actuarial firm to do a completely independent third-party study, and they arrived at this 1,700 savings. And now, in this year, we're looking for our first opportunities to prove that in real life with our first Medicare Advantage pilot.
All right, that's awesome. Congratulations on that. And you rattled off a few names of some pretty big companies in there, but one that you did not include is probably I was going to say a famous, but maybe notorious at this point, company that you worked with, Haven. So the JP Morgan, Berkshire Hathaway, Amazon joint venture that has since stopped. You guys actually worked with them for a while and are like actually a shining star of an example of one of the projects that they implemented that worked. So say more about that. Can you tell us anything about working with Haven and how that all came about and what happened?
I always appreciate a shining star here. I mean, look, I feel incredibly privileged to have been vetted by some of the greatest innovation organizations between Aetna Innovations, and then it was really through our work with JP Morgan Chase that the opportunity came to participate in the first Haven-sponsored medical trial in the JP Morgan population. It occurred over 2020. We've just completed our first year. And so despite the announcement earlier this year, that there's been lots of talk of, Utopia actually is one of the only organizations that, external organizations that was vetted and has a completed Haven backed trial in the JP Morgan population. We're just preparing our outcomes to provide them back to our clients at JPMC, but also to the other consortium members. And while I can't disclose the results just yet, I can say it's the best work we've ever completed in Utopia's history, which I couldn't be more proud of, and more so because it happened in a COVID year. And so the outcomes that we were able to deliver, physical, mental, and emotional, outpaced anything we've ever done in a COVID year, which is outstanding. And again, just makes me so confident about our ability to scale and deliver these outcomes broadly across the market.
Yeah, despite all of the banana bread baking that's been going on for Instagram, I mean, that's pretty remarkable. If you've been able to impact people on their nutrition and some of their biometrics, that's amazing. So let's talk about this new category now, because I cover the chronic condition management space quite closely, especially on the health tech side. And I've got friends from Livongo, which was acquired by Teladoc. I mean, OneDrop, which also is in this space. And there's so many others, Vita, Verta, you can keep going. So, why start a new category? And I have to say too, I was there when Livongo started the applied health signals category. And one of the things that I, used to needle Glenn Tolman on was you can't be a category of one. So how do you start this new category, Jeff, habit change provider, and then who else is going to be in this? So you're not just a category of one, and it's not just like a marketing thing.
And Jess, I knew you were going to come at me with this, and so I really
project now.
and look, it is fair, and I so appreciate it. Look, as we all try to play it bigger and arrive at a categorization, I think for Newtopia, it's been a journey of really realizing what we've been all along, and realizing what's been missing all along in the void that we can fill. And as a habit change provider, it's not just a name or a marketing tie-in we're trying to find. It's really pointing to something incredibly missing.
Define it for us so we can buy in.
It's really primary prevention that's been missing in the marketplace right now. And I am a giant fan. I'm not a provider or an MD or a health professional myself, but I have the greatest, utmost respect for them. But when you look at providers today of any kind, PCP specialists across the board, what's lost is primary prevention and the art of really changing individuals' behavior around nutrition, around exercise, around mental and behavioral health, combine that lifestyle behavior change. It's not being offered today. Most Americans don't have a PCP. If they do, This is not the focus of their attention. So much has been moved on to retail, and now with COVID, accelerated into telehealth, all fantastic changes, and I applaud them, except none of those players are providing primary prevention, are providing that fundamental habit and behavioral change around how we live each and every day, which is at the root of all of these non-communicable diseases that we suffer from around the world. And so as a habit change provider, that's what we do. And we do it, I believe, better than anyone else. It's that focus on really meeting individuals where they are, building up these new habits, and changing them so that individuals become the engine of their own growth. And ultimately, the hope is to prevent, reverse, and slow, and just keep healthy people healthy for as long as possible. And as a provider, we also have full interest in working collaboratively and trans barrier here. So whether it's with employers, or whether it's with insurers, or whether it's with pharma, or even other providers, recognizing that we're not solving all of the issues, but we're solving a really important one that hasn't been solved, and hence the decision to launch the habit change provider category as something truly that's needed. I think there are others that play and are attempting to do it, and it's our hope actually to, by labeling habit change provider, to have others join us in this effort, really at primary prevention, at lifestyle behavior change, and at focusing on keeping people healthy as opposed to a dominant sick care approach.
So like this to me, like when I was reading the description of it and the characteristics of like a habit change provider, it sounded like there could be a lot of mental health companies that would fall into this. I mean, and especially, and I think it's interesting that like where you guys are at, it's like you've got the the more traditional approach to chronic disease management coupled with the genetic approach to it, and then wrapping around all of that is this behavior change thing, which is very much like it reminds me of like cognitive behavioral therapy. I mean, it very much is like how do you get out of your own head and make these changes, right? So I mean, like, who do you see then joining in that category? Is it more like those mental health providers? Would that be an easy in as a habit change provider, or who else? Like, give us some of the hallmarks, or if you want to rattle off some companies and challenge them to jump into your category, let's hear it.
Well, I'd say so. Look, I'm a great fan of the innovation community, and I feel incredibly privileged to work alongside and create alongside a lot of them. My beef has been with some of the siloing that's gone on. Mm-hmm. It's I'm in the physical health camp to prevent diabetes, or I'm in the mental health camp, incidental, or things where I'm actually a much bigger believer that there's one health, and that is it's physical and it's mental and it's emotional, and it's trying to achieve all of those things, as opposed to if you're an insurer or an employer out there, which is, I need a mental health solution, and I need a diabetes prevention solution, or I need a diabetes management or a hypertension solution. There's been so much siloing out and carving. And in fact, now what we're seeing, of course, is a whole lot of platform formation, which is let's try to be a one-stop shop for all. Some of those things get dangerous when you're stacking companies, and what you became really good at is lost and the outcomes get lost. We've seen examples. It's called Healthways, and I think there's a lot of Healthways 2.0 taking place. But my challenge is actually for more groups and innovators to join us in this one health movement, which is we're here to improve physical health. We're here to improve mental and emotional health, and also adding to resilience and performance, and really offering maximal value to either the providers we partner with, and the employers or insurers, so that we're driving the greatest value on investment and value on health possible.
Okay. So Jeff, who do you see Newtopia competing with? So I mean, like the way the landscape is now, there's not enough companies taking this one health approach, but like who do you guys see as your competitors?
I think in a traditional sense, that's been a moving target for a long time. Within
who's in the line of fire right now, then?
Yeah, well, for a long time, within in the diabetes prevention space, there had been a whole slew from Omada to Canary to Retrofit, which then became Livongo, and I think there's been a lot of cross-section activity of trying to blend condition management, prevention, mental health into one. Wonderful companies like Vita, Lark, all respect and really love what they're doing. And so while I would say that, I don't think we competes it with anyone, because I don't see anyone truly meeting each individual where they are, building one size fits one, using that precision health approach and following a proven habit change approach, right there, not to teach or to make someone smarter, like we're trying to educate, but actually to build confidence and have them become the engine of their own growth. I don't have another group that I can necessarily point to there. And so I don't want to be lonely. I just want to have others join us, because I actually also believe that there's no way one group can possibly solve this. It's when more and more innovators get together and realize that if we can solve this one health problem for the benefit of all the insurers in the market, now we can really add to that triple or quadruple aim.
All right, so what's next for Newtopia? You've launched the new category, habit change provider. We're welcoming others to jump in, so you don't have to go it alone. You're well-funded. I mean, like I said at the top, I mean, you guys are publicly traded on the Toronto Stock Exchange, the TSX, $60 million market cap US, Canadian, 40 million US. So what's next for you guys? You're armed with all this information, the great study results that are coming out of this Haven work that you did, and then also this recent actuarial study of the Medicare Advantage population. Where do you go from here?
I mean, look, we've within the clients we have, there's a dirty little saying that we're the best kept secret, and I am not interested. While I'm interested in continuing to serve their populations incredibly well, I'm not interested in continuing to be the best kept secret. And Jess, I'm a little scared. And here's what I'm a little scared of.
Uh-oh.
I'm a little scared that what's going to come up on 2 years of us all. By the way, the greatest habit change experiment possible has been COVID-19, right? Where, I mean, talk about this perception that we can't change habits is hard. Look at all the habits we've changed. Unfortunately, they haven't been positive.
No.
Right? And so we've been sitting, largely inactive, socially distanced, probably not eating well, lots of weight gain, lots of mental health and stress issues, rightfully so. I mean, all of us are feeling this, but that is the kindling for pre-chronic disease risk, which then leads to more chronic disease, both physical health issues, mental health issues. And I think there's a tsunami of risk following COVID-19. And while a lot of focus is being put on vaccinations, rightly so, it must happen. Let's not lose sight of what follows it. For every cause, there's an effect, and there will be an effect on this 2 years. And what I'm really focused on is, can we achieve moving away from best kept secret so that we can start to be proactive with the employers and the public and private insurers out there to get ahead of this tsunami, because it's going to hit and it's going to cost a lot. And more importantly, it's going to drive too many of that 80% at risk into the category of sick care. And at $3.6 trillion of spend, there's only so many more that can go into it before the whole thing falls apart. And without focusing on prevention and primary prevention, I'm scared about where the status of just how the macro and the micro work for individuals and for the entire healthcare system. And so really, when you talk about what's next, we are in with 2 feet, wanting to really help as a habit change provider and do our part.
No, and I think that is a wise way to look at the impending future here. I mean, what staggering to me, you mentioned that $3.6 trillion spend. I came across recently a CDC statistic that says that 90% of that spend, 90, is for chronic conditions. So, I mean, that to me is just crazy. I mean, and I think that you're right. I mean, I've been kind of keeping my eye on this as a trend to watch moving forward, is, what's going to happen after this is over. Have you heard anything from employers and health plans, like your client base, that you can share with us? Any gossip about how they're looking at this and how they're tackling it?
Like I hear a lot of worry and a lot of concern. I mean, and of course, the first steps are just COVID ramifications. Are we hiring? Are we firing? Are we vaccinating? How are we getting people back to work? And that's where we are. But behind all that is a realization that the risk that they had before and during is somewhat being masked by this weird year of cost. Like, as people stood back, if this is going to be 2020 is going to be a very weird year. But I don't think anyone believes that the cost savings are going to last and that there isn't going to be a wallop coming soon. And so in the conversations we've been having has been this recognition of really looking at the at-risk population, that 80%, in a very different way than they have before, as opposed to just let's deal with what we may have once believed. They just have to manage the risk of the individuals who are sick and maybe offer a little bit of wellness. I think as the world has changed, there's a realization that we need to eliminate the risk and do it through primary prevention and habit change. And so those are conversations that we've been excited to have and look forward to having more and more this year.
All right, last thing for you, just so we can end it on a positive note. I just, riffing off of your point about the fact that we have had to go through so much habit change this year, to just deal with COVID. Have you seen anything positive in that? Like, are you maybe, is there maybe can you bright side me on this a little bit, Jeff?
Well, yeah. So whenever we talk about behavior change and habit change, you get this glazed over look sometimes. It's like, oh, people don't change, and oh, behavior change is hard, and habit change, isn't that really hard to do? And I'd say the silver lining of all this is that we've realized, one, just how adaptable we are when we need to be. Two, that change can happen quite quickly. Just think of what this year has been and the change it's wrought in all of your lives. And even though they may not have been so positive, that same method, I think the silver lining here is that I actually think habit change is easier than many people believe, but it just has to be done right, with a focus on actually meaningfully changing habits, as opposed to teaching, telling, or bringing people to the mountain. Really all we're trying to do is bring, the silver lining here is I think there's an opportunity to bring people to habit change a lot easier. And I'm really excited about the opportunity to do that at scale.
Awesome. Well, Jeff Ruby, the CEO and founder of Newtopia, thank you so much for joining us. Newtopia, don't forget, the one but not the only in a new category of habit change providers. We're going to hold you to that, Jeff. I'm going to start referring people your way. Thank you so much for stopping by and talking to us. And we look forward to hearing more about the success that you guys have. So please stop back and see us again and give us an update on where you're at. We love hearing about novel ways to help with chronic condition and chronic disease management. So I'm happy to have you back on as the year unfolds and we get a little bit more room underneath our feet to make some of those changes that can make a difference.
Thanks so much for helping innovators like us really tell our story and let everyone know what we're doing. Really
happy to do it. And so to see more of those innovators, thank you for setting me up, Jeff. You can head on over to my YouTube channel. Just go to youtube.com/WTF Health. I'm Jessica DeMassa. We'll talk to you guys soon. Thank you so much for joining us on What's the Future Health.